Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Women's health is a priority, and understanding menopausal acne is essential. Often overlooked, this topic holds great significance as it impacts the quality of life during a pivotal stage in a woman's journey. Raising awareness about menopausal acne empowers women to approach this phase with confidence and equips them with the knowledge to make informed choices. Through open discussions, we can bring attention to its importance and foster an environment where proactive care and education thrive. So let us explore the significance of menopausal acne and work towards solutions that prioritize women's well-being and overall health during this transitional phase. Welcome everyone. I'm Dr. Soumya Saluja from THIP Media. And to help us delve into the significance of menopausal acne, we have with us the distinguished medical expert, Dr. Gurman Singh Bhasin. Dr. Gurman Singh Bhasin is a board certified dermatologist with advanced training in clinical and aesthetic dermatology. He serves as a consultant dermatologist at Care Hospitals Nagpur and is about to launch his clinic Skin Clarity this month, which will be state-of-the-art dermatology clinic in Nagpur, offering cutting-edge skin, hair, anti-aging solutions. Dr. Bhasin holds multiple fellowships in aesthetic dermatology, lasers, dermatosurgery, and advanced aesthetics, showcasing his expertise in advanced laser procedures, cosmetic dermatology, and innovative anti-aging treatments. He has also contributed as an expert consultant in skincare product development, creating research-backed formulations. Committed to accessibility in healthcare, Dr. Bhasin is experienced in telemedicine, ensuring high-quality consultations for patients remotely. His scholarly contributions, including publications in national and international journals, reflect his dedication to advancing dermatology. As a thought leader and innovator, Dr. Bhasin continuously strives to blend science with aesthetics, delivering patient-centered care that drives exceptional. Dr. Gurman Singh Bhasin, Pip Media welcomes you, sir.
Thank you so much. It's my pleasure to be here.
Thank you so much for joining us today, sir. Okay. Women, they manage countless responsibilities in their household, yet often overlook, their own health.
Agree.
And it's essential for women, especially during transitional phases like menopause, to have access to comprehensive information about their well-being. And one such concern is maintaining healthy skin. So, with that in mind, I am going to start this discussion with the most fundamental question that, menopause as it is a very challenging phase. So, what are the primary causes of menopausal acne?
Okay, so like you said, menopause. So this is
Yeah,
because of hormonal changes and fluctuations which occur in females. So
right,
here they are stopping their periods cycle, the menstrual cycle. So the
right,
primary cause will be the hormonal imbalance. There is an
right,
estrogen decline that is occurring, which leads
right,
to relative androgen dominance, which
right.
increases the sebum production by the sebaceous glands. So
Okay,
this leads to clogging of the pores and hence acne.
right,
Estrogen is also, it prevents our skin barrier from certain infections and inflammation. So
right.
when estrogen is declining, the acne overgrowth occurs. The Cutibacterium acne is the bacteria which causes the
Okay,
acne. So the
okay,
overgrowth occurs, again leading to acne. And
okay.
at that point of time, the female is also going through certain, stressful situations. There's a
Right,
stress at her age. The cortisol level here increases, which again
right.
leads to more sebum production and
Okay,
acne. And also, some females at that point of time also tend to gain weight.
yes.
This leads to insulin resistance, which
Okay,
higher insulin levels, they stimulate the androgen production,
okay,
contributing to the acne. And finally, we should add all this that your environmental factors like poor sleep leads to cortisol rise leads to, acne,
Okay.
pollution, smoking, and diet definitely leads to the worsening of acne.
Okay. So, I mean, you've just given me a very long list of
Yeah, but
menopausal
the
acne.
primary cause, I would like to sum this up, is hormonal imbalance, that is the decline of estrogen.
Okay. So let's say estrogen is the villain here, the
Yeah,
declination.
yeah, you can definitely take it that way.
Okay. So how can menopausal acne be identified, and what are its distinguishing symptoms?
Okay, so when we are pointing out on acne, there are many types. Okay, so
Right.
the ones that occur in puberty, which is the normal
Hmm.
age of acne, they occur over the face, over the oily gland regions, over the mid cheeks, but these are specifically known as acne tarda in our scientific language.
Okay.
Above 25 years of age is acne tarda. The location is primarily the jawline. Okay,
Okay.
and these lesions are deep inflammatory nodules, which are
Okay.
often into treatment surrounding with dryness and redness also,
Okay.
and they are very chronic and they keep recurring. So yeah, the jawline is something which hints you to hormonal disturbance.
Right, right. And like you've just mentioned that women at a certain age of life, they are surrounded by a lot of, let's say, a stressful environment, and the environmental factors, they actually are, the worsening agents for menopausal acne. So, would you say that emotional and psychological effects, menopausal acne can have?
Definitely, your self-esteem is impacted. So if there
Right,
is visible acne over your face or jawline, the confidence goes down. Social
right,
interactions that is affected. Even mental
right.
health, these cause anxiety and depression because you have persistent breakouts. And there's this cycle that comes up, a psychological distress cycle, which
Okay,
worsens the acne. So definitely it is linked to
right.
stress and emotional and psychological effects it does have.
Okay, right. And now coming on to the treatment part of it,
Yeah.
what are the most effective dermatological treatment options which are available for managing menopausal acne?
Okay, so definitely, like we started with the primary cause, that's estrogen decline. So why
Right.
not do something about that? So we give anti-androgens because when estrogen is declining, your androgen rises. So we give
Right.
anti-androgens like spironolactone, which
Okay.
is given in such cases, along with the drug of choice of acne, which is low-dose isotretinoin. So we
Okay.
start with a step-by-step protocol, like in any
Okay.
other case. We give topical agents, topical retinoids, adapalene, benzyl peroxide, and tretinoin. Azelaic acid can be given. Then we go for systemic therapy, like I've mentioned, anti-androgens, which is spironolactone, low-dose
Okay.
isotretinoin. Sometimes short-term antibiotics can also be given.
Okay.
Then we also have advanced procedures like peels, glycolic acid, salicylic acid peels, lasers, and microneedling. Also, there is something known as hormone replacement therapy, which
Right.
is we are restoring the estrogen balance to be precise, but this
Okay.
is only for selected patients. It's not a first line therapy. And
Okay.
last, an add-on for a long-term diet control, your hydration levels, definitely
Okay.
those are added.
Right. And you just mentioned that hormone replacement therapy is not meant for all the patients, right? So the ones who are already taking hormone replacement therapy or are, people have been prescribed for a particular reason, would you say that prolonged consumption of the therapy can lead to certain risks or
Definitely.
any long-term effect on their bodies? What could be they?
Yes, ma'am, definitely. So the benefits are that the estrogen balance is maintained and everything becomes good, but all
Right.
is not good if you take it for a long term. Definitely, there is a risk of thromboembolism. There are
Okay.
cardiovascular disorders, and even in certain amount of cases, breast cancers are also linked with hormone because you're giving hormones to a person, and that's
Yes.
for a long period of time. So you know how things react in people, you don't know. So that's
Right.
why we always select, we do a primary line, secondary line, and third line. And then for resistant cases, when there's no other option, we go for this, but in a very limited and a very observed manner.
Okay. Right. And now, something that a person or a woman can do at home, the
Okay.
skincare routine, right?
Before
So,
she develops acne or like while she is on
uh,
acne.
of course,
Okay.
for menopausal acne for the
Yeah.
session. So, what role does skincare play? in controlling menopausal acne, and what products would you suggest your patients they should use and avoid in this particular stage?
I completely agree. See, I always start with something simple. I always
Okay,
tell the patient to go for a gentle cleanser, a pH balanced cleanser, a
okay,
daily sunscreen with an SPF above 30, because it's important for the pigmentation of the acne and the skin aging. And most
okay,
importantly, moisturizer should be a non-comedogenic one. That
okay,
is most important. So this is a basic cleanser, sunscreen, and moisturizer. These three have to be there. What you
okay,
need to avoid is those harsh scrubs, that can lead to definitely acne, or alcohol-based toners, heavy
okay,
oil massaging, all of that. It should be avoided. It clogs your pores. So you should
okay,
avoid that or keep it to once a week. That's it. Yeah.
okay. Right. And in the beginning of the session, we also mentioned about these interplay between menopausal acne and diet. So
Yeah.
coming on to that part, can diet and nutrition impact menopausal acne? And are there any specific foods that would help or, harm the particular condition?
Agreed. Definitely, it plays a major role. So,
Okay.
your high sugary and high glycemic foods that we call, which is bread, sugar, processed carbohydrates, these are not good for your acne. Your
Okay.
dairy, that is especially the skimmed milk. So, it
Okay.
increases your insulin-like growth factor 1. This
Okay.
triggers the breakouts. So, you should definitely avoid high glycemic foods. That would I would say. Best
Okay.
ones, like we always hear, is omega-3 rich foods, whatever
Okay.
has like fish, walnuts, etc. They reduce the inflammation and hence helps in reducing the acne. Your
Okay.
antioxidant rich foods like leafy green vegetables, berries, etc. They
Mm-hmm.
improve your health. And hydration. Definitely water is your best friend, your skin's best friend, I should say.
Right.
But on the same hand, I feel that only water or hydration or food cannot help you. You should
Yes.
start your treatment also with it. So these are additive things, but don't
Mm-hmm.
miss your treatment for sure.
Okay. And now, apart from diet, what
Uh-huh.
additional lifestyle adjustments can, women adopt to minimize menopausal acne flare-ups?
Definitely, ma'am. So, like we talked about the age at that point of time,
Yeah.
obesity develops. So regular exercise, this improves your insulin sensitivity and
Okay.
circulation. Definitely quality of sleep. Your poor sleep, which raises cortisol. So please keep
Right.
your sleep normal, regular.
Okay.
Reduce your stress by doing yoga, meditation, breathing exercises. Definitely try and avoid smoking. Everything should be kept in moderation.
Right.
And manage your stress. Lower the cortisol, I should say, lower the inflammation. That would be my point.
Okay. But I think it's easier said than done, especially for working women.
I
So, any stress reduction treatment, do we have some dermatological options for working women in such cases?
Uh, for stress reduction, actually, it's more important. Dermatologically, there is nothing very, that you can, for stress reduction, you can do. But I feel this is an overall, like, how do I say? You should give a personalized treatment plans. Like while we are doing it, it should be very person to person because there is stress.
Right.
The causes of stress are different for many people. Some people
Right.
can have stress due to the hormonal changes only. So I feel you should try and pinpoint, the doctor should help and try and pinpoint what is the cause. The primary
Right.
cause we know, but what is adding to the stress? And I guess work accordingly. I cannot exactly pinpoint something that is
Right.
come from the I guess I will need a psychiatrist to help me with that for sure.
Okay, right. And now coming to the very important part is empowering women about the right
Yeah,
knowledge. So,
right.
how can healthcare providers like yourself empower women with actionable steps to manage menopausal acne?
So the first thing is what we're doing right now. Spreading
Okay,
awareness, educating
right,
patients about this. So this is the first step that us doctors should take out time from our busy schedules and do this also because this is very, very important at this time and age. And
right,
once you get the patient, you should tell the cause, you should have a personalized treatment plan, like I was saying before, also that what are the factors, how is it helping or not helping the patient.
Right.
We should very much emphasize on the lifestyle changes of the patient with your
Right.
skin care. It's very important. And most importantly, encourage the follow-ups, because patients sometimes think, yeah, I see the doctor once and this is it and that's done. It's not like that. It's a very long process.
Right.
Like I said, menopausal acne are persistent. So they trouble
Right.
you. So why to face the trouble when you have the doctor waiting for you? I feel that should be emphasized by us practitioners only.
Okay. So I think being in touch with the doctor at the right time is the key here, right?
Agreed. Agreed.
Okay. So I'm just going to summarize this wonderful session by one final question, that what should be included in a to-do list for women who are navigating through this transitional phase called menopause to maintain their healthy skin.
First and foremost, please don't shy away from going to a doctor, be it a
Okay.
gynecologist, be it a dermatologist, because this is nothing wrong. There's nothing wrong. Like there's nothing wrong in the having the periods. It's completely normal and going through this phase. Women, especially in India, I've seen they hide this a lot, and that's why the endometrial cancers in our country are so common, because women don't want to speak up. So first and foremost, please go and take advice from a certified doctor, and in our case, a
Right.
dermatologist, and go for a approved dermatological skincare routine.
Okay.
Use always evidence-based medications. Don't try and see many other things, like, take something from somewhere and just see something on social media and do it. Nobody over
Right.
there is going to come and help you when you face the side effects. A doctor sitting in a clinic will always be there for you if you have
Right.
any side effects. So, and maintain a good, like I said, low glycemic diet. Prioritize yourself, prioritize your sleep, your exercise, and your stress reduction activities. Again, be regular with your treatment and with everything. I
Okay.
feel I should say that consistency is a key for everything. So
Right.
first you should open up, take advice, then follow it consistently, and follow back to the doctor. I feel this is what is much needed. Yeah,
Right. So, being in touch with a certified doctor, then, the evidence-based treatment or a skincare routine and a balanced lifestyle.
agreed.
Great. Right. So, on that wonderful note, I appreciate your presence with us today, sir, and I'm hoping that the enlightening information shared will be valuable to many women out there. So, thank you so much for joining us. It's really been a pleasure.
It was a pleasure for me also. Thank you so much.
Thank you. And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again.